Middle East Respiratory Syndrome (MERS) is a viral respiratory disease caused by a novel coronavirus. Middle East Respiratory Syndrome coronavirus or MERS-CoV that was first identified in Saudi Arabia in 2012. Coronaviruses are a large family of viruses that can cause diseases ranging from the common cold to severe acute respiratory syndrome (SARS), as told in the last video. Typical MERS symptoms include fever, cough, and shortness of breath. Pneumonia is common but not always present. Gastrointestinal symptoms including diarrhea have also been reported. Some laboratory-confirmed cases of MERS-CoV infection are reported as asymptomatic, meaning that they do not have any clinical symptoms, yet they are positive for MERS-CoV infection following a laboratory test. Most of these asymptomatic cases have been detected following aggressive contact tracing of a laboratory-confirmed case. Approximately 35% of reported patients with MERS-CoV infection have died. Although most of the human cases of MERS-CoV infections have been attributed to human-to-human infections in healthcare settings, current scientific evidence suggests that dromedary camels are major reservoir hosts for MERS-CoV and an animal source of MERS infection in humans. However, the exact role of dromedaries in transmission of the virus and the exact routes of transmission are unknown. The virus does not seem to pass easily from person to person unless there is close contact, such as occurs when providing unprotected care to a patient. Healthcare-associated outbreaks have occurred in several countries, with the largest outbreaks seen in Saudi Arabia, United Arab Emirates, and the Republic of Korea. The clinical spectrum of MERS-CoV infection ranges from no symptoms or mild respiratory symptoms to severe acute respiratory disease and death. A typical presentation of MERS-CoV disease is fever, cough, and shortness of breath. Pneumonia is a common finding but not always present. Gastrointestinal symptoms including diarrhea have also been reported. Severe illness can cause respiratory failure and requires mechanical ventilation and supports in an intensive care unit. The virus appears to cause more severe disease in older people with weakened immune systems and those with chronic disease such as renal disease, cancer, chronic lung disease, and diabetes. Approximately 35% of patients with MERS have died, but this may be an overestimate of the true mortality rate, as mild cases of MERS may be missed by existing surveillance systems and until more is known about the disease. The case fatality rates are counted only amongst the laboratory confirmed cases. Source of the virus. MERS is a zoonotic disease, which means it is a virus that is transmitted between animals and people. Studies have shown that humans are infected through direct or indirect contact with infected dromedary camels. MERS have been identified in dromedaries in several countries in the Middle East, Africa, and South Asia. The origins of the virus are not fully understood, but according to the analysis of different virus genomes, it is believed that it may have originated in bats and was transmitted to camels sometime in the distant past. Transmission. Non-human to human transmission. The route of transmission from animals to humans is not fully understood, but dromedary camels are the major reservoir host for MERS and an animal source of infection in humans. Strains of MERS that are identical to human strains have been isolated from dromedaries in several countries including Egypt, Oman, Qatar, and Saudi Arabia. Human to human transmission. The virus does not pass easily from person to person unless there is close contact, such as providing unprotected care to an infected patient. there have been clusters of cases in healthcare facilities where human-to-human transmission appears to occur, especially when infection prevention and control practices are inadequate or improper. Human-to-human transmission has been limited to date and has been identified among family members, patients, and healthcare workers, while the majority of MERS cases have occurred in healthcare settings. Thus far, no sustained human-to-human transmission has been documented anywhere in the world. Since 2012, 27 countries have reported cases of MERS, including Algeria, Australia, Bahrain, China, Egypt, France, Germany, Greece, Islamic Republic of Iran, Italy, Jordan, Kuwait, Lebanon, Malaysia, the Netherlands, Oman, Philippines, Qatar, Republic of Korea, Kingdom of Saudi Arabia, Thailand, Tunisia, Turkey, United Arab Emirates, United Kingdom, United States, and Yemen. Approximately 80% of human cases have been reported by Saudi Arabia. What we know is that people get infected there through unprotected contact with infected dromedary camels or infected people. Cases identified outside the Middle East are usually traveling people who were infected in the Middle East and then travel to areas outside the Middle East. On rare occasions, outbreaks have occurred in areas outside the Middle East. Prevention and treatment. No vaccine or specific treatment is currently available. However, several MERS specific vaccines and treatments are in development. Treatment is supportive and based on the patient's clinical condition. As a general precaution, anyone visiting farms, markets, barns, or other places where dromedary camels and other animals are present should practice general hygiene. Measures including regular hand wash before and after touching animals and should avoid contact with sick animals. The consumption of raw or undercooked animal products, including milk and meat, carries a high risk of infection from a variety of organisms that might cause disease in humans. Animals' products are processed appropriately through cooking or pasteurization are safe for consumption, but should also be handled with care to avoid cross-contamination with uncooked foods, camel meat, and camel milk are nutritious products that can continue to be consumed after pasteurization, cooking, or other heat treatments. Until more is understood about MERS, people with diabetes, renal failure, chronic lung disease, and immunocompromised persons are considered to be at high risk of severe disease from MERS. These people should avoid contact with camels, drinking raw camel milk or camel urine, or eating meat that has not been properly cooked. Healthcare facilities. Transmission of the virus has occurred in healthcare facilities in several countries, including from patients to healthcare providers and between patients in a healthcare setting before MERS was diagnosed. It is not always possible to identify patients with MERS early or without testing because symptoms and other clinical features may be non-specific. Infection prevention and control measures are critical to prevent the possible spread of MERS in healthcare facilities. Facilities that provide care for patients suspected or confirmed to be infected with MERS should take appropriate measures to decrease the risk of transmission of the virus from an infected patient to other patients. Healthcare workers or visitors. Healthcare workers should be educated and trained in infection prevention and control and should refresh these skills regularly. Travel. WHO does not recommend the application of any travel or trade restrictions or entry screening related to MERS. So that's all what I got for this video. Hope you enjoyed it, and if you did, smash that like button and we'll see you all next time. Subscribe and click the notification bell to get fresh content from EduVision, as this channel provides you verified information. Bye bye.